on Your Health, marking 20 years since the Massachusetts Healthcare Reform Bill. It was signed into law on April 12, 2006. Here to talk about it is Dr. Daniel Chandler, primary care physician and associate chief medical information officer at Tufts Medical Center. Thank you for joining us.
Hi, Jessica. Thank you very much for the opportunity.
Yeah, you know, Massachusetts has one of the highest insurance coverage rates in the country thanks to this law. From a doctor's perspective, how has that changed the way patients access care?
It's really hard to understate how important this change has been. Health insurance really allows people to have a primary care doctor and a medical home. And the alternative to that is often the emergency department. And a care in the emergency department can be very expensive.
Yeah, let's talk about that because the big issue right now, it's cost. What are you seeing firsthand when it comes to patients being able to afford care?
I think having a primary care doctor in a medical home really gives them a place to ask those easy questions like infections or aches and pains. You can get some necessary screening done and preventive care, and that really allows you to get care when it's relatively easy to fix and it's less expensive. Patients complain about cost all the time. And they choose their plans basically oftentimes based on that cost. And the premium is not the full cost. Often there's a lot of copays that can add up if you choose the wrong plan.
Yeah, so for people who have insurance but still get really overwhelmed by the cost, what advice do you have for them? What do you say to those patients?
It's difficult because choosing a plan, oftentimes there's open enrollment, and that's only one time of year. The topic is incredibly complex. And so if you have resources like family members or friends who are knowledgeable, I always recommend that you ask them. Your primary care doctor can be an excellent resource as well, although they may not always have a ton of resources to help you. That they can help you find some savings. I think that many times patients are overwhelmed by medical costs, but oftentimes their costs are not just medical. They may have food costs or housing costs or transportation costs. And we have social workers in my own clinic that can often help you find solutions to all of those problems.
And also, you know, that problem can also affect, you know, skipping treatments, medications. What are you seeing in terms of what that affects in terms of their long-term health?
It can be really catastrophic to avoid treatment for problems. If a problem is easy to fix early in its course, that can get more difficult and more expensive over time if you don't fix it early. We have a pharmacy team at Tufts Medicine that can often help look at your entire medication list, for example, and try to help you find the cheapest alternatives to save costs, either from a tier change or a formulary change, or sometimes there are coupons available that we can offer to you. And these are services that are available outside Tufts, obviously, as well. And I would encourage all patients to try to look for that.
All right, Dr. Chandler, we appreciate you joining us. Thank you.